Hi, everyone. My name is Chris Sprague from Persimmon Health. I am a serial entrepreneur working on healthcare technology that helps more people access better quality of care. This podcast is for the movement of innovators, entrepreneurs, intrapreneurs, and thought leaders that are advancing the American healthcare system through digital health. In this podcast, we highlight real stories of innovators and enablers of digital health, their opportunities, challenges, and learnings for innovation. We'll cover topics such as startup building and fundraising, entrepreneurship, emerging technologies, and big ideas to transform healthcare. We invite you to participate in this community, share your stories, and accelerate the movement. Thank you. We have an awesome pod. Enjoy. Hello, digital health community. Today, our guest is Florian Otto, co-founder and CEO of Cedar, a company that works with payers and providers to personalize and humanize the financial experience for patients, in particular for traditionally opaque and frustrating questions like how much is something going to cost, what is my insurance covering, and how am I going to pay for it? And we'll discuss why Florian started Cedar, how Cedar helps, where it's going, and get some advice for other entrepreneurs. Florian, welcome to the pod.
Thanks for having me, Chris.
Absolutely. Now, you have quite a journey to this point, from medicine to McKinsey to what became Groupon Brazil, and then ZocDoc. Would you mind telling us a bit about that journey?
Sure, very, very happy to do that. And yeah, the journey might not make sense in the first side, but in the second side, actually, there is, I think, is an arc that is kind of getting over my career. So you probably hear that from my accent. I'm from Germany originally and studied medicine and dentistry, was a maxillofacial surgeon for some time, did my PhD. So it was a pretty academic career on the medical side. And then joined McKinsey, worked there in healthcare consulting in Brazil. So wanted to move to Brazil. Was a fantastic time, and then started in 2010 a company that got acquired by Groupon, and then became CEO of Groupon Brazil. Was there for 3 years, and then joined ZocDoc for a few years. Was their head of sales, and then back in 2016 started Cedar.
Got it. And when you started Cedar, you've talked about having a remarkably bad medical experience that resulted in confusion, frustration, and disillusion with the healthcare system. And your inspiration was that experience for starting Cedar. Can you tell our audience about that experience?
Absolutely, and the bad experience was actually by my wife.
Okay.
So what happened? She fainted on the street, which happened when nothing too bad. Got treated extremely well in the hospital. We swiped the credit card for the copayment, and thought, okay, everything was done. And then a month later came the first stack of papers for her to pay from the hospital. Another month later came bills from the imaging center. And then half a year later, she landed in collections by bills from the lab company that she never received. So she changed her address, and they apparently emailed her, they mailed her old address. So complete disaster. And what she basically told me was interesting. She told me, after she resolved everything, never take me back to that hospital. And then I asked, okay, why is that, right? It's just the billing, the medical was really good. She said she completely lost trust in the entire organization. And I think it's an interesting thing, right? And Chris, you might know this trust is kind of consistency over time.
Yes.
And this consistent experience was broken there. So trust was eroded. And she basically put this halo over the entire visit. I mean, there is this saying, the first and the last experience usually matters. And that was completely messed up in this case. So we basically said, okay, consumers are expecting more. Because when consumers right now have a touch point with every single other business, usually the digital experience is better, right? When they hail an Uber, they know already. I mean, Uber knows where you want to go before you open the app. If you open Amazon or Netflix, it's personalized, right? So everybody has a different dashboard there. And of course, everything is extremely easy and transparent. And in healthcare, that is not the case. So we basically set out and said, okay, our mission is to bring healthcare to the 21st century, to put the consumer really in the center of everything. And of course, we strongly believe that the healthcare consumer is exactly the same consumer that shops on Amazon, that books the flight on Kayak, or that also watches Netflix. And that is their bar and their experience level. Then the reality is lower than that, causes dissatisfaction.
Got it. So you created a consumer first platform that really wanted to facilitate better financial experiences than, for example, your wife had. And I know you use data science and smart product design to do that. What are some of the most fundamental ways or problems with the financial experience that you're trying to tackle with Cedar?
Yeah, I think, the financial experience is pretty messed up, pretty much everywhere, right? And I think a few of those things are structural and very difficult to really figure out on the technology side, because there's just a structural problem. So let's call it one of the biggest problem I have with the US healthcare systems. The healthcare system is that the people with the lowest income have the highest deductible and the richest people have the lowest deductible. That makes no sense. It should be the other way around. Rich people can afford a deductible and low income people should have a low deductible, right? So that is the fundamental problem. And to be clear, we cannot change that. Let's be realistic. However, what we can do is the following. We can basically make it for everybody more affordable, more easy to understand, and reduce the friction out of the entire process. So we call this compassionate billing.
Got it.
So what are we basically doing? We are putting, instead of just being provider first and just churning out paper statements or digital statements in the same sort of manner for every single patient. So sometimes it's called one size fits all solution. I would rather call it one size fits none solution. But we try to personalize that so that we basically reach the patients where they are with the right message that resonates with them, with the right offer to pay the bill. For some people, it's literally just convenience that matters. So Chris, if you right now forgot to pay a co-payment for $25, it's probably convenience. If right now we send an invoice to a patient, for example, that lives in a median house, in a zip code where the median house value might be $200,000, patient defaulted on 2 invoices before, and the invoice is maybe $1,000, we would ask them to set up a payment plan. So we will put the patient in the center of everything and build the billing around it, because we want that the patients can really focus on getting healthy instead of worrying about this financial experience.
Right. And how does Cedar's technology work to facilitate that type of experience? Could you walk us through that and maybe some of the outcomes?
Yes, absolutely. So we basically have a pre-visit and a post-visit solution. And together that is the Cedar suite. So we're basically picking up after you booked your appointment to send you a gentle reminder on checking in for your visit. And there we have, of course, a lot of just workflows that are geared towards the financial experience. So you can snap a photo of your insurance card. We do eligibility check. We tell you how much is your co-payment and your estimated out-of-pocket. You can already either pay it there or set up a payment plan if you know it's elective procedure.
Okay.
And then, of course, we are walking the consumer after the procedure or after the visit also through this process. So it might be, for example, that they have a denial of the claim. We can do a claim submission through denials messaging. It might be that there's another balance to pay because they changed their procedure. So there are a lot of things where we are helping the patient, guiding through the process. And then a new thing that we launched right now, you might have seen it last week, was the launch of the payer intelligence layer. So throughout this process, having payer information on top of the bill, having a one-click to pay deduction from your HSA or FSA. So how many people really forget about their HSA, FSA card? Direct integration is, of course, a game changer for that, and knowing their out-of-pocket accumulator status.
Yeah, no, that's great, because I think our healthcare industry is kind of rife with these fragmented experiences and really fragmented incentives across patients, providers, and payers. And I think it's amazing that Cedar is really working with all 3 of those, or really 2 of them, on behalf of the patient. So Cedar is all about meeting patients where they are and then guiding them throughout their financial journey. And everyone benefits when they get to the end. I think that's interesting because, like, I mean, one of those biggest, topic areas within healthcare right now are things like omni-channel and personalization. So that idea that you're talking about, that patients want to engage with their providers in a way that is convenient for them, and then there isn't this one size fits all. So I'm really happy to hear that you're thinking about this and meeting people where they are. But there's probably a lot of complexity in making that a reality. Can you just share a little bit about what you've had to do on the technology side in terms of connecting providers and payers, and to even have a chance of giving this kind of experience?
Yeah, I think it's a great question because let's be frank, the idea is not novel. When you look into every other industry, this is a personalized experience, right? Your Netflix account looks different from mine and so on. So it works everywhere. I mean, like personalized discounts as well, works everywhere. To make this a reality in healthcare is actually very, very difficult. So you asked about the technology and all this stuff. So let me walk you through on what are kind of the obstacles we're facing and why is that so important.
Okay.
So the first thing is, of course, we need to have integrations with different stakeholder systems. So what is that? The first is the billing system or the EHR. Those integrations, they're not necessarily easy because not all of these EHRs have proper working APIs. So it just literally is a challenge to integrate with them. Secondly, we need to integrate with the payers. They also have their own systems where they send the EOBs. Also not that easy. When you have these, and then of course you need to integrate with HSA, FSA vendors to have the one-click to pay function.
Right.
That is surprisingly a little bit easier than the first two.
Okay.
But then comes the problem. You need to normalize all of the data because the data is usually different in these different parts. And you, of course, need to find kind of with unique identifiers that you can match the records.
Right.
That is one of the biggest problems to structure these data. And you're working on pretty large data sets, right? We are interacting with more than 20 million patients right now on an annual basis. So it's lots of work to do there. So then all of a sudden you have the database on then you need to marry that with database from external parties. So for example, I mentioned it is very interesting for us to know what is the median house value of a zip code. It is very interesting for us to know if there is right now, I don't know, what is the demographics of a certain neighborhood to personalize this message. And most of that is actually marketing databases. So they are available kind of openly and publicly for purchase. So we are doing those integrations as well. So we are matching that. And then the third thing is, which is actually one of the easier ones, is the internal Cedar database. We know what worked with patients before. And we have engagement data. So whether a patient clicked on a certain link and where did they click, that triggers a different follow-up message. So takes us to the last point, is just the digital architecture of our platform. That, of course, we have a cloud-hosted architecture. So why is that so important? Because we need to do iterations literally multiple times a day.
Right.
When you are right now a system of record, like an EHR, you update once a year, maybe once a quarter. We are updating a couple of times a day. Makes a huge difference because we are running around 20 A/B tests at every single time.
Okay, got it.
And we are automatically shifting most of the traffic always to the highest conversion. So typical examples of that is, of course, we all know the typical example, blue button, red button, what converts higher. But it's way more complex to that. It's which kind of copy when we send a text message works better. Which time of day do we send a text message that works better? Which kind of follow-up do we send if somebody logged into the bill but didn't pay? And then segmented by patients, by balance size, by what they paid already. So it sounds all very easy, but the background is actually extremely complex. And that is the magic that really happens where for patients it's very easy, but the technology is extremely complicated.
Right. Yeah, that's awesome. We have a lot of experience integrating with the EHRs and the billing systems and the like. Yeah, and I can tell you, yeah, none of it is easy, or maybe it looks easy from afar, but it is never in practice. And I think that's amazing that you are operating exactly like, let's say, a Groupon startup would operate, which is iterating multiple times a day and measuring everything. And what's awesome is what you're measuring is the patient finding it easier to do what they want to do or not, which is
Yeah, and we
great.
are obsessed by
Yeah.
that. We're totally obsessed
Hmm. Right.
by getting the feedback from the patients and
Hmm.
reducing the friction in every single time. So we're getting tens of thousands of feedbacks every day. So we are data mining that and finding out where are the friction points, and then go literally from the highest impact to the
Right.
lowest impact and knock out new communication methods or products that facilitate the patients through this difficult time.
Yeah, that's incredible. And so you have all this engagement data, and you are kind of getting a sense of what's needed next for Cedar. Can you share anything about Cedar's product vision and roadmap? Maybe continuing after the payer intelligence layer.
Yeah, absolutely. So the payer intelligence layer, we basically literally just launched last
Uh-huh.
week. So it is something that is much newer. Highmark and Allegheny Health Network in
Okay.
Pennsylvania, so in the Pittsburgh region, they started as a pilot partner with that. So building this network is extremely important. And we strongly believe that besides just offering the best billing product and best personalized experience in the market, we are literally building this network of these integrations, provider to provider integrations,
Okay.
professional and healthcare and hospital billing, or third party like anesthesia or emergency room billing or lab billing. We layer that on top of the other bills. So provider integrations. Second integrations
Right.
are literally these provider payer integrations,
Mm-hmm.
where I mentioned we can put the payer intelligence layer on top of the bill. That's the EOB. Second is the accumulator status. Third is we can exchange data between provider and payer on demographics. And then the fourth things there is we can have these direct HSA, FSA integration.
Right.
And also we are working on the future on an integration of the support center. So when you chat, for example, with one party, that party can loop in the other, which of course is really nice with the consent of the patient, because all of a sudden the patient is not the ping pong ball between provider and payer getting referred from one to the other, but it's more
Right.
in the center of both, and both parties try to help them. So we strongly believe that is important. And
Mm-hmm.
then I think the last integration lever is basically system integration with financial services. So like, for example, I mentioned HSA, FSA, that is a huge thing. So we found out that actually half of the patients that are eligible for an HSA pays with credit card. So that makes no sense, right? Because you should
Right.
use the pre-tax dollars.
Mm-hmm.
And
Mm-hmm.
why is that? Patients forgot their card, they forgot their access code, so they just pay quickly with their credit card. But if you have a direct integration and the only thing is a one click to pay, you of course use these pre-tax dollars in order to pay for it.
Okay, yeah, that's great. Yeah, because one of it sounds like what you're doing is you are aggregating everything that would be needed for a consumer to know who they have to pay and then facilitate how they pay for a particular procedure. And, one of the big issues within healthcare is not knowing upfront or even after the fact who I have to pay or how I'm going to pay them. For example, your wife's lab example, or going in for a colonoscopy, and then it's sent off to a separate diagnostic, and they turn out to be out of network, and it all just gets so jumbled up. So I'd love to unpack one of that frustration with healthcare, which is price transparency. So just knowing ahead of time how much a procedure is going to cost me. And as someone in healthcare, it's still surprising to me how often I get surprised and that there just doesn't seem to be a great solution for this. Um, Now, there's something called the hospital transparency rule, which is supposed to help. But I believe Cedar's research finds that nearly half, 49% of US consumers haven't even heard of the rule. And those that are familiar, nearly a quarter don't understand it. First, in case anyone doesn't know, what is the rule?
Yeah, so it's a very interesting question, and I think a typical example on what happens if a change is being made by the government and regulation and not by the consumer. That really is, I think, the beneficiary of it. So basically, what the rule says is that that the hospitals need to publish their price
Hmm.
for certain procedures. So right now you have basically two groups of people before we even get to whether it's possible or not. There is a certain group of patients where literally price estimate doesn't make much sense. And
Hmm.
those are those when you don't know what will be done with you. If you go right now, I don't know, to a hospital and you have a huge pain in your belly area, you don't know what this is. It might be appendicitis, it might be
Right.
problems with the gallbladder, it might be peritonitis, it might be whatever. Nobody will be able to tell you on how much that will be.
Right.
But then there is, I would call it the shoppable experiences, and that's probably we find out around 80% of the procedures
Okay.
where at least an estimate should be possible. Why is that so difficult to get an estimate? I mean, sounds easy, right? You basically,
Hmm.
I tell you what I need and you tell me what it costs. Very difficult. Because why is that difficult? Because of fee for service model, where literally the hospitals or the physicians bill for every single item,
Hmm.
so on a CPT or DRG code level. Secondly, often for one visit, there are different business entities involved in that. So, for example, anesthesia bills separately from
Right.
the physician professional side or from the inpatient side. And then on top of that, of course, comes the insurance. And the insurance will tell you this and this is this is the billed rate, this is the negotiated rate, we
Hmm.
pay this, and this is the deductible. And it depends on how much you have in your deductible left. So all of these things make it, of course, more complex. So if you, for example, have like many hospitals have it for some procedures, bundled pricing, then of course it gets easier. If you just say a knee replacement is XYZ.
Right.
So long story short, you asked me also on how we are going to address it. I told you about the complexities of that, and really it is not
Hmm.
easy. And I want to take this into consideration. Hospitals want price transparency in general.
Okay.
It is just extremely difficult to communicate that. So we strongly believe that there are many procedures where we can give price transparency. There are some where we cannot do it. We
Hmm.
don't focus on the ones where we cannot do it. If you just have an emergency and you come in, you don't need it. However, if there are very easy ones, for example, you just need a chest x-ray. That is a simple one, and hospitals are really, really good at estimating that. The
Okay.
only thing we need to know right now is where are you out-of-pocket deductible. When we have that information, because we have payer integration, we can tell you exactly how much it cost, prepayment of a certain rate, you're done with it. Very simple. And then comes right now the bit more complex
Hmm.
visit reasons. You are somewhere, you know what will be done, but you don't know exactly who will be involved, how long the surgery, for example, takes, which kind of material, because sometimes the doctor doesn't know. Just an example, you get a hip replacement, which kind of prosthesis should be implanted until
Right.
you open the body. That is literally a problem. So you cannot, of course, right now give a price guarantee because you don't know which
Hmm. Hmm.
material will be inserted or how long anesthesia. So you basically can give estimates. And what we strongly believe that some hospitals are really good in giving estimates together with claims data. We get into a range where we can
Right.
convert it from an estimate to a guarantee.
Wow.
And that
Okay.
guarantee, of course, is a game changer for patients. And why is that a game changer? Is the following. You might remember when Uber in the beginning started to charge for, I think, the mile and the minute, right?
Hmm.
It was terrible, wasn't it? You had no idea how
Yeah.
much a trip cost, whether it was expensive or it was cheap. You had no idea. And then they switched towards an upfront guaranteed price for the trip. Wasn't it beautiful? And what happened was the following. All of a sudden, conversion rates went through the roof. Satisfaction of the riders went through the roof. It's
Hmm.
not that it got cheaper, but you basically took away the anxiety of this entire experience. And that is something that we are doing in healthcare right now as well.
Yes. And one of those anxieties, as you're just talking about, is that element of surprise. And earlier this year, the No Surprises bill went into effect. Can you talk a little bit about this ruling? And I mean, are there any different outcomes that are going to be driven by this?
Yeah, I'm glad you asked about it because no surprise bill, of course, is again one of those things nobody really wants to do. It's one of the few things, actually, surprise, surprise, um, both political parties are agreeing with. So there are still some of those things because it's very tough not to agree with it.
Mm-hmm.
So what does that basically mean? That means basically that you are going to an in-network provider, for example, a hospital,
Mm-hmm.
and there's, for example, a staffing company or an independent organization doing treatment for you that is out of network and then just balance bills you. Doesn't seem to be fair because you as a patient think you are in an in-network provider and you of
Right.
course have no idea where the physicians work for. So that is not fair. So it's basically in regulation right now where providers need, where out-of-network providers have limits on what they can bill. And that, of course, makes total sense, right? They cannot just bill a complete crazy amount.
Mm-hmm.
But even more important than that in the back end is to know it before, because then all of a sudden it becomes a non-issue. If you give a price guarantee for the bundled price, then you actually don't care how the funds afterwards getting distributed.
Right.
So
Right.
that is where, of course, we are working on integrating some providers. For example, staffer plus hospital plus
Mm-hmm.
professional side. And that really is the game changer for the patient.
Right. Yeah, that's amazing. Yeah, Bimal, our producer, had a procedure done, and it turned out his anesthesiologist was out of network, and that was not broached to him beforehand. That was a huge part of the increase in his bill, for example. So love that you're taking away that element of surprise, or at least making it someone else's problem, if that's the case. And I really appreciate that as an industry. I guess we're starting to move in this right direction. And it's really platforms like you created in Cedar that are moving the needle and producing the impact for consumers that many entrepreneurs seek when we're starting a company. And a sizable segment of our audience is physician entrepreneurs that, like you, noticed a big problem in the system and that was painful enough that they were inspired enough to stop practicing and just solve it. And you started in medicine. And before we end the podcast, I would love for you to give your advice for physician entrepreneurs. So what piece of advice would you like to give physicians looking to start their own venture?
Yeah, it's an interesting question. So, I mean, first of all, I admire everybody who makes a real big change in their career. And going from being a physician to become an entrepreneur is not the most direct way. There, of course, let's call it, there are very direct ways to become an entrepreneur. It's just opening your own practice. You're an entrepreneur, right? 50% of the physicians are this kind of entrepreneur. But making this to really do something that has nothing to do with medicine and
Mm-hmm.
touches the field, of course, outside of really caring for patients, I think is very interesting. So the first thing is maybe, okay, really know why are you doing this? And I can maybe share on why I did this
Mm-hmm.
pivot. I think the first was that I got really interested by doing different things throughout my career. And as a surgeon, you really are good if you do one thing again and again. So it became a little bit boring for me. And then the second thing, why I was so excited about starting a company was the scalability of that. So as a physician, you're of course limited, especially as a surgeon, to your two hands. How fast, how good can you make surgeries? So it's not that scalable. And
Mm-hmm.
starting a business like Cedar right now, we're interacting with more than 20 million patients a year. That is really exciting. So the one piece of advice that I would like to give to physicians is actually something that's very physician specific
Mm-hmm.
and can be very dangerous in entrepreneurship. This is dealing how to take risks. Because as a physician, you are trained not to take risks, which
Mm-hmm.
makes sense. When you are treating a patient right now, you're not wanting to take risks. When you do surgery, you go with the clinical pathways that are prescribed for a certain procedure. When you're an entrepreneur, this doesn't exist. Because by default, you're doing something new.
Right.
You're breaking ground. So taking risks, they're usually not deadly. they're usually not harming anybody when you take risks. They're usually two-way doors. You do something, it fails, you go back, you try again. So a very different mindset, I think,
Right.
position and starting a company.
Yes, yes. Have to flip that mindset. And Florian, as a final question, I wanted to unpack something you mentioned, which is the need to get perspectives from outside of what you've been doing. And I know we can often learn from other industries. And given your experience across other industries, what are some of the insights you've seen from your Groupon days or consumer or anything else, which you feel like for us people also trying to innovate in healthcare, that we should borrow from those domains?
Yeah, I think one of the most important things is to really understand where is the problem, and is that a problem that you can solve,
Mm-hmm.
and is that a problem you're not just literally obfuscating and covering? Are you
Mm-hmm.
really solving the problem from the ground up? That is the most important thing. So what do I mean? What do I mean by that? A lot of new ideas or companies are basically being built on things that at some point will go away anyway, or they're just messed up incentives in healthcare. I think that is very, very bad, because at some point those companies should go away when the fundamental problem is basically being solved. Focusing on something that is a huge suffering in the healthcare system, like in our situation, the financial experience, it's a huge problem. And really trying to solve that from the ground up
Mm-hmm.
in a very detailed way is, in my opinion, extremely important. Because when you do that, you're delivering value for every stakeholder in the systems. So like for Cedar, I cannot really tell you whether consumers benefit more from it or the
Mm-hmm.
providers. It's
Right.
actually really, really funky to say, right? Or payers even.
Right.
Because we basically make contracts with providers, but
Mm-hmm.
in the end, we all have the same consumer. So we treat the consumer well, providers like it, and then of course we also grow. So in the end, it's really important where every side likes something, and we deliver value for all sides.
Right. Florian, yeah, I think that's a wonderful way to summarize. And I want to thank you for coming on the pod. I'm really inspired by companies like Cedar that are managing to align incentives to the end of better patient experiences, or in your case, via better patient experiences. Thanks again. We'll be rooting for you.
Wonderful talking. Thanks for having me, Chris.
Thank you. Thanks for listening to this podcast and being a part of this movement. This podcast is brought to you by Persimmon Health, and offering by Leapfrog Technology that's purpose-built to help innovators imagine, build, and scale digital health products. We're passionate about fixing healthcare and have worked on over 50 digital health products. If you want to share your story or want to work together, please shoot an email to hello@persimmonhealth.com. Thank you once again, and I look forward to seeing you on the next podcast.